So in terms of patient engagement and engaging, those accessing our services at Bevan, it's a real key element of what we do. I mean, one of our values is around, to collaborate, and that collaboration has to start with people who are benefiting from our services, and ensuring that they have a voice and a say in what we do. In order to have meaningful engagement, that means different things to different people. So what's absolutely crucial is that we are offering a range of different ways, different opportunities and choice around people's participation and engagement in Bevan. So one of the ways that we do that is around our patient participation groups. And how we deliver those is around, not expecting people to come to us. If we want to demonstrate the value of their voice and their opinion, it's about us going to them. So, we, take those groups out into the community, out where, to where people live, etc., to give people as much opportunity as possible to feed back into the services. So for us, engagement is around a kind of co-produced model, and that's where, we're involving people in service design, we're involving people in reshaping current services to constantly improve those, and also really importantly around co-delivery, so around actually being involved in the delivery of services at Bevan. A really good example of that, and something that we're really proud of, is our peer advocate programme. And that's where we work with people with lived experience of homelessness, being a refugee or asylum seeker, and train them up to support and help other people within those communities and other individuals who are currently, experiencing those aspects at the moment. And it's a real kind of strengths-based approach, that so it's around recognising the skills and expertise that we've got within individuals who've accessed services, and to be able to harness those to help others, and when that's either helping them access services or actually giving direct support to people who are accessing Bevan. So it's also a really good example, that scheme of whereby, as a social enterprise, we are able to reinvest in, innovative services that make a difference. So our peer advocates, some of them now starting to come into paid employment with us. Some remain, in a volunteer capacity, which is absolutely crucial and has so much value to the organisation. And it creates a real win-win, because it helps peer advocates realise how appreciated their skills are, and enables them to kind of give back and make a difference to the communities. And it also is a really good example of how, when I was saying about social enterprises before, and the ability to be agile, what we're able to do with our peer advocates is to spot a need in the community and respond really quickly. So a really quick example of that is, last week we identified a need with a group of young male unaccompanied asylum seekers who were having to fend for themselves on an incredibly tight budget and didn't really have any cooking skills. And one of our peer advocates, his background was being a chef. So what we were able to do was to pair, obviously, our peer advocate with this group of young men, and to be doing cooking on a budget. And we were able to turn that around in a really short space of time, so that the need was identified and the solution was found, and it's been done in a completely kind of co-produced way. So I think that's a really good example of the value of a social enterprise, but absolutely the value of that patient engagement and involvement, and kind of true participation, because when they're delivering frontline services with us as part of our team, and as a really valued part of that team, the difference that is made is phenomenal. And it really is about, valuing that lived experience, and ensuring that, people with that lived experience feel valued as part of the Bevan team.